I'm James. I'm a neurosurgery trainee based at Royal London Hospital, and I'm a senior research fellow in the tech group. So my research projects are focused on wearable technology in surgery. Wearable technology is any device that can be worn on the body and has a sensor. And there's been a huge expansion of these devices in many industries, but broadly, we've been investigating them to firstly identify what do patients feel about wearable technology used in their surgeries. And we did that with a large survey that was disseminated through patient groups and social media. And secondly, we did a scoping review to answer the question, what uses are wearable technologies currently? Secondly, we did a scoping review where we asked the question, what use cases are there currently for wearable technology in surgery? There are many different types of wearable technologies in surgery at the moment, and they can be worn on many parts of the body. So I suppose that's one way you could split it up. Firstly, these wearable technologies can be worn on the head, and you may have seen examples of this, like the Apple headsets, where you can have augmented reality, virtual reality, and even mixed reality to help surgeons be given more information during surgery. Secondly, there are many wristwatches available on the market that can provide really important data like heart rate, temperature, and this can give us an idea of the stress that a surgeon is under during surgery. And thirdly, there's a large category of different types of wearables which are able to sense pressure. So one example of this is a surgical glove which has sensors on the end of the fingertips that can actually pick up forces as low as 0.1 newtons. And we've developed this at UCL to give us an idea of surgical performance of trainees in relation to expert operators. This topic really interests me because I think wearable technology could really revolutionize the way that we carry out surgeries. So one way it could do it is through actually giving us more information during surgery. So at the moment, it can be difficult to identify different structures during surgical procedures, especially when there's been a lot of blood in the field or the dissection planes aren't so clear. Wearable technology would potentially be able to provide us with an overlay of the anatomy that we're seeing during a procedure, and hopefully this will reduce the risk of inadvertently damaging critical structures during surgery. Another way that wearable technology I think could revolutionize surgery is through the enhancement of training. So at the moment, surgical trainees learn their skills through an apprenticeship model whereby they shadow a more experienced expert surgeon for many years, and the feedback they receive can be very subjective and is prone to bias. I think wearable technology can really plug this gap by providing us objective feedback on our performance over time and allow us to track progress and identify weak points. So one way that we've been investigating this is through these surgical sensorized gloves that can pick up forces as low as 0.1 newtons. And a way that I think this information can really help surgeons is recording the forces done on, say, an external ventricular drain insertion and reviewing how I did this procedure a month ago, a week ago, and then in the future, how am I performing it to a more expert level. And this will be able to identify weak points in the procedure and help us really work on our weak points. And the idea is that this will actually lower the learning curve and allow surgeons to really progress as fast as possible. One of the clinical problems we're trying to address is that there has been a real explosion in the number of wearable technology devices available on the market. And these have been used in many industries, but one of them is surgery. But unfortunately, there has been very little work on how patients feel about the use of wearables in surgery. And it's really important when developing these devices that we have patients in mind, because it's very unlikely that a device will actually be used in clinical practice if it's not acceptable for patients. So one of the ways we've investigated this is through a very large patient survey in which we have disseminated the survey through patient support groups and through social media. We have thankfully got a large number of responses, and I believe the data is going to be very helpful in the development of future wearable devices. There's certainly some barriers, and the barriers at the moment are very much from a technology point of view. So wearable headsets are by far the most common type of wearable available at the moment, and they currently have lots of drawbacks. And sometimes the actual accuracy of the information that they're portraying is not excellent, and that can have huge ramifications for their use in surgery. For example, if a headset is telling you that the internal carotid artery is in a certain location, but that is incorrect, then that can have huge implications for patient safety. So there's a lot of ways to go, but it's very encouraging. The current use of devices, wearable devices, has been shown to be moderately helpful. What we now need to identify, is it going to make a big difference or a significant difference to patient outcomes and patient safety in the future?